Good evening, everyone. Welcome to the program. We'll just wait for some more people to join in. Also, we kindly request you to stay on mute so that the program's flow is not disturbed. Thank you. So if anybody has testimonials to share their journey in functional medicine, kindly do so. Just raise your hand and we will unmute you and let you speak. Anybody has anything to share? Okay, so we will start the testimonial videos.
For me, a lot of good changes have happened over the last couple of weeks. Starting with my menstrual flow. So I would say that has got better as compared to what it was earlier. I think skin glow has increased a lot. And second thing is that my dark circle has started reducing. I'm very convinced that I would like to follow this diet at least for in the long term.
I was spreading from double XL to triple XL in my dress size, and I have come back to my double XL, and my knee pain is gone, which was the latest last 6 months biggest issue I had. I couldn't walk, but it is gone. And if I strain too much, it is the feet pain. Small issues are there, but my major pain was the knee pain, which is gone. I hope that if I continue doing this and I succeed in losing more weight, and things can get better. I don't want anybody to face what I've faced in my life. It's very tough. Being a woman, being what we have to do in our lives, the responsibilities hold, not only physically but emotionally. I think it's great. Continue, guys, all of you. All the best, and I really hope this works for all of you and you guys get healthy.
Joining the program, I used to feel that life is just going out of my hand. But this program was doing, and the fasting accelerated, I think, the speed of mental and emotional imbalance. And now I feel that, everything is now in my hand. I feel that I can take charge of things. So that was a huge shift throughout the month.
I was diagnosed with 4 big size of fibroids in around the same time lockdown last year, and due to some extensive exercises and physical workout, 1.5 years I went through hell. I tried everything: Ayurvedic, homeopathy, Siddha medicine, everything. I've tried everything and it just didn't work. I also tried hormone pills for 3 months, and that just thickened my wall and had some complications. So a friend of mine suggested to do this program, and I did this program. I was still going through hell during the program. There were many days in the program my video will be off because I'll be going through so much pain and cramps that I'll be lying down, and I cannot even attend the program properly. The situation was really bad. As I followed the diet that they are suggesting, and medicines and supplements, just the lifestyle, I would say that I was just determined that, okay, fine. I asked doctor how much time it will take for me to heal. So she said about 4 to 6 months. I said, okay, 4 to 6 months, I'm going to devote myself to whatever they are saying. So I went through, and every month it was definitely difficult, but every month it started getting better. Since last month, there is no pain. I mean, I don't know, I mean, it's like not less than magic for me. It's bearable, very bearable, I would say. No pain. Yes, bleeding is still there, but it's changing. I would say every month I see something, a drastic change. ऐसा नहीं है कि थोड़ा थोड़ा change हो रहा है. It's a drastic change. So I don't know, मैं जितना कहूँ उतना कम है, but I'm ready to share how much ever possible I'm willing to do, and I just hope that you take this step and just go through the program.
So just message on the chat group if you're able to listen to the voice. Kindly. Okay, great. So kindly, you will receive a poll on the screen, and then just take the poll, and we would love to know what brings you here. So please kindly take the poll and let us know whatever issues you're having, so that we can focus more on those.
Ruhi, I think you will have to launch the poll.
I did, Siddarth.
So for the people who just joined, we are just taking a poll. So kindly answer the poll, so we get a better idea of what brings you here. Thank you for answering the poll. We're going to end it now. So, okay. So, good evening, everyone. Welcome to our session. So, this is a path in which we rediscover our health. Most of us joining here today have faced problems in multiple areas like diabetes, PCOD, thyroid disorders, autoimmunity, obesity, and even gut health. So we are here today to address these issues via a functional medicine approach, which is going to the root cause rather than just treating the symptoms. So welcome, I am Dr. Apurva, a functional medicine clinician. We would love to know what brings you here. And today we have two experts in the field of functional medicine, Dr. Ruhi Agarwala, a doctor by profession. She has done her master's in global health and certification in functional medicine from US. She is also a co-founder of Functional Medicine Clinic and has successfully reversed hormonal imbalances in more than 1,000 women. And Mr. Siddarth Goel is a functional medicine expert and health coach. He's also a Hatha Yoga trainer. Dr. Ruhi and Mr. Siddarth are creators of this Hormone Reset program, which is a unique program exclusively for women, as we face a lot of hormonal imbalances in this current scenario in the world. So let's start this session, and I now hand over to Dr. Ruhi.
Thank you, Apurva, and namaste, everyone. Thank you for joining in today. Just give me 1 second. So, when we saw the poll, we see that a lot of you are here because of some chronic issue or the other, be it thyroid disorders or PCOS or autoimmune conditions, gut issues, and you name it. So let's start with breaking some very common myth. And the first and the foremost, most important myth that women often hear is, or are rather made to believe, is the period pain, cramps, mood swings, acne, swelling, bloating, everything that a woman experiences around the periods, that's normal. So how many of you agree with this, that you're made to believe that all these symptoms are normal? So no, none of you believe that it's normal? It's not normal, right? So Nanda, yeah, very much true. It's not normal, but because everybody around you is facing it, it's just assumed that these symptoms are normal. But the truth is, period pain is not normal. Whatever troubles a woman is going through before or during the periods, that's not normal. Healthy periods have to be very smooth, and the pain would be such that it won't affect your day-to-day life. But because everybody around you is experiencing it, it's just made to believe that it's normal, and you believe it's a part and part of your life. But again, there are reasons why it's becoming a part of your life. The second most common myth, and what women struggling with hormonal issues are often offered, is a birth control pill or a hormonal pill, right? That's the only solution for hormonal imbalances, be it endometriosis or fibroids or PCOS. Hormonal pill is the only solution. Again, that's not true. And maybe it's some of you who are here are already on those hormonal pills. But let's understand, how can a pill fix all your hormonal issues, right? And we will come to that later. A hormonal pill is like, you are outsourcing your hormones to some synthetic hormone that you will be taking every day. And once you stop it, your own hormones are just going to be silent. You have just allowed someone else to take over your own hormonal physiology. You may get regular periods or, but then it's not at all helping address any of the causes that's leading to your hormonal issues. So hormonal pill is just a band-aid fix to your problem. Often the periods are considered to be, it's just something that, it's about fertility, it's about reproduction, and it has nothing to do with the rest of the body. But periods are actually, it's about very much what a woman feels on a day-to-day basis. It's like the sixth most vital, the sixth vital sign for a woman. It's about how a woman feels every day, how her skin is, how her hair is, how her productivity is on a daily basis. So it's not just about it's not just about reproduction, it's about so many things that a woman goes through every day. So healthy periods, it's very much important, and it does not have to wait until you want to, you want to have a child. It's something that should be healthy right from, right from menarche. Again, for some of you who are trying to struggling to lose weight, how many of you are struggling to lose weight and are still doing the calorie counting? You eat this much and you work out this much and you will be able to lose weight. Again, that's very old science. What we eat is, and what actually, you're burning, all that depends on how your cellular function is. So you may be really starving yourself and you may still be putting on weight. And that's because of your poor cellular metabolism. So calorie in, calorie out does not work anymore. There's a lot more details that goes into a proper metabolism in the body, which we will learn more today in the webinar. And again, when it comes to thyroid disorders, one pill every day in the morning will fix all your thyroid problems, which again is one of the, one big myth all thyroid patients are made to believe. A thyroid pill is again just like, you are outsourcing your own thyroid hormones to something synthetic without even looking into why you have actually got a thyroid issue. It can be autoimmunity, it can be lack of raw materials, it may be chronic stress, it may be inflammation in the body. So it can be so many things which a thyroid pill will never fix. And the last and the most, I would say it's becoming, because it's becoming increasingly common today, autoimmune conditions. Earlier, it would be few cases and mostly in the older age group, but today we see early 20s, or even in children, we are seeing autoimmune conditions. And the myth around it is that it's incurable, it's a genetic disease, and you need to take a lifetime of medications. But let's understand, you were not born with an autoimmune condition, you developed it during your lifetime. And if that's the case, there are certain choices you have made during your lifetime which has caused that disorder. And if we identify them, correct them, we will be able to reverse it. So before we start, how many of you are looking for weight loss? How many of you want liberation from all the issues that you've been struggling with and want to have weight loss, want to have better sleep, want better hair, clear skin? You do not want bloating anymore. You don't want painful periods. So liberation to achieve all this. So a lot of you. And we can only achieve this if we actually address the root cause of why we are struggling with all these on a daily basis. And to achieve this, we'll have to change the approach we are taking. Now, hormonal imbalances, as I said, it's not just about periods, but it's about so many things, what you see right now on the screen. It's about how your skin is. It's about unwanted hair growth. It's about thyroid issues, difficulty losing weight, mood swings. You feel as if, you are bearing the entire burden of the world. And it's something your hormones are making you feel that way. You're struggling with gut issues and it gets worsened during your periods. You feel irritated all the times. Migraines have become a part of your life. Hair loss, breast lumps, PMS symptoms, cyst in the ovary. So these are some of the different ways how hormonal issues can show up. Now tell me one thing, can one pill fix all these issues? If you go on a hormone pill like a birth control pill, can it fix all these issues? It may help you get a regular period, but it's not going to fix your mood swings. It's not going to fix your gut issues, neither your hair, none of them. And the same with the thyroid pill, right? It may, initially it may give you some symptomatic relief, but over a period of time, you will see you're stuck. So what we really need to do is change the approach. We need to stop treating each symptom separately. Whatever your body is trying to tell you in the form of symptoms, all the symptoms are connected. Your gut issues are connected with your pain. Your hormonal issues are connected with your mood, your, the way how you're feeling. So we need to stop treating each symptom separately and rather look at all the symptoms collectively and address them. And of course, going on the pills, it's not the solution, because in that case, we will need to have 20, 30 pills for each symptom that one is facing. What we really need to do now is change the approach, look beyond the hormones. Your hormones are already out of balance. So why they're out of balance? Let's look into those. So if we have to bring, pin down to two main drivers of hormonal imbalance, the first is insulin resistance, and the other is estrogen dominance. How many of you have heard about insulin? Is it only about diabetes? So most of the times insulin comes in context with diabetes. So it helps in your blood sugar regulation, but that's not the only thing where insulin plays a role. It's a metabolic hormone and is a major driver of hormonal imbalance. Now, insulin resistance means that insulin has stopped doing its job. It's not doing what it's supposed to do. Now, insulin is supposed to push the blood sugar into the cells after you've taken a meal. Okay. Now, imagine if you are taking a meal 3 times a day, which is rich in refined carbs. So every time you do that, every time you have a meal which is rich in white rice, for example, your blood sugar will increase. The pancreas will be asked to release more insulin hormones to push that glucose into the cells. Initially, your body is able to cope up with that, but then over a period of time, it cannot, it's just fed up with your behavior, and insulin will be released, but then it's not able to push that into the cells anymore. Okay, the cells have become resistant to insulin. And this is again because of what is going on inside the cell also. Of course, outside the blood sugars are high because of our behavior, and inside the cellular machinery is also getting damaged because of, refined carbs, because of a sedentary lifestyle, toxins, deficiencies, chronic stress, as a result of which the cells just stop responding to insulin and the blood sugar remains high, and those blood sugar have to go somewhere. So they start depositing in our body, making you put on weight, which is typical belly fat, fat on your face, fat on the back of your, on the back. So that's what insulin resistance causes, and it's difficult to lose that weight. And not only this, it will go to a lot of other places, such as your liver, giving you a fatty liver. And a lot of your symptoms of hormonal imbalance come from that insulin resistance. The second most important driver is the estrogen dominance. Estrogen, again, is a very important hormone in females, which again is not metabolized, is not removed from our body. Then the same estrogen can cause havoc in our body. So estrogen is removed from our body by the liver. So if the liver is busy treating the infections, treating the toxins that's accumulated in your body, it will not be able to remove it, as a result of which it will just start accumulating. Similarly, if someone has chronic constipation, which we again see with a lot of our patients, chronic constipation again means estrogen metabolites are not removed from your system. They keep getting reabsorbed and again leading to estrogen dominance. So this is how something as simple as gut issue can result in hormonal imbalance. Now, I talked about insulin resistance, which basically, high blood sugars, high insulin levels, you're putting on more fat, you're putting on weight. And more fat cells means, again, more estrogen. more estrogen conversion, as a result of which more estrogen dominance. So insulin resistance and estrogen dominance, they go hand in hand. Second, so much of glucose in your blood sugar, now it has to go somewhere. So it starts depositing on your liver, giving you a fatty liver. You never had alcohol, but you have a fatty liver, and this is where it's coming from. You're prone to diabetes because, again, the root cause is the same. Your cholesterol is haywire. Again, because, more blood sugar gets converted to triglycerides, making you, again, your cholesterol goes high. Now, where is the hormonal symptoms coming from? Where is your acne coming from? So high insulin means more conversion into male hormones, and these male hormones give you acne. They'll give you the typical male pattern baldness, which is, on the hair or on the head. You start putting on a lot of, start getting a lot of unwanted hair growth on your face, on your other body parts. And that's because high insulin is converting into more male hormones. How is the estrogen dominance manifesting in your body? You find your breast to be very tender before the periods. You have a lot of PMS symptoms, heavy periods, painful periods, and when it comes to manifestation, they can manifest as fibrocystic disease, which is basically cyst in the breast, lumps in the breast, cyst in the ovaries, endometriosis, uterine fibroids. So these are different ways how estrogen dominance manifests in our body. Now, if we have to correct this, we have to go back to what we have been doing on a day-to-day basis. So let's get deeper into some of the very common root causes. The first and the foremost is poor diet. Today, the diet that we are eating has become nutrient poor. One may say that, I'm eating home-cooked food, but again, what is your home-cooked food made up of? If it is rich in white rice, if it is rich in wheat, if it's, you're taking a lot of sugars home-cooked, again, that's a problem. Your diet is not a healthy diet. Processed food, anything which is, mostly, so the more whole grain you eat, wholesome food you eat, the healthier you are. The more processed it becomes, it's getting devoid of nutrients. Seed oils and refined oils are, again, not healthy, especially if you have high inflammation in the body. So they are rich in omega-6. It's not that omega-6 is not good, but then you need a balance between omega-6 and omega-3. So if you are, if you have inflammation, you have hormonal issues, you have autoimmunity, you should restrict your intake of seed oils and refined oils so that you can bring back a balance in your omegas. Today, again, the diet is largely low in raw fruits and veggies, which again, makes us more prone to nutrient insufficiency in our body. And 80% of our body is water. So you may be drinking 5 liters of water a day, but still, if the water you're drinking is not the right quality of water, and here I'm referring to structured water, it's again unhealthy. So what today largely the water we drink is coming from the RO, which is basically dead water devoid of minerals. And this is doing no good for cellular hydration. So the water we drink has to be structured, needs to have a life in it. And the dairy and the meat products, most of the time it's contaminated with a lot of hormones, with a lot of antibiotics. And when our diet is rich in such conventional dairy and meat products, we are allowing these hormones to get into our body and mess up with our hormones. So one of the most important things that, one needs to do with any chronic condition, be it hormonal imbalance or autoimmunity or anything, is to have a clean source of dairy and meat, if at all you are taking those products. So Annie will come to what to eat. Now, the toxins, we are exposed to a huge amount of toxins on a daily basis. One is, of course, the toxins we are exposed to. And the second is our detoxification pathways are not as good as it should be. Okay. So toxins comes from the conventionally raised produce and animal products. If your gut health is not good, you are not eliminating the toxins from your body. You are just reabsorbing it back, which again increases your load of toxins. Hormonal pills are again, are synthetic hormones, and they are source of xenoestrogens. Xenoestrogen is something that mimics estrogen and again messes up our hormone. So all hormonal pills are sources of xenoestrogens. All conventional beauty products are loaded with xenoestrogen. So they are basically ingredients which mimic estrogen and they disrupt the endocrine receptors. Unfiltered water, again, a source of various heavy metals, which are endocrine disruptors. Conventional cleaning products in cleaning our washing liquids or dishwashing liquids, all these are loaded with industrial solvents and ingredients, which are endocrinal disruptors. Plastic, if your food is coming in contact with the plastic, you are exposed to BPA, which again is an endocrine disruptors. And most important, stress. If you're chronically stressed, your metabolism is basically slowed down. The body is not focusing on anything, but only preparing you to fight that stress, which again means, the toxins are again not eliminated from the body and becoming a part of your body. And as you do that on a daily basis, the endocrine system is getting disrupted. Liver and the gut are two most very important organs which have to be in good function if we want to have a good, healthy body. Okay. Now, our digestive system has a whole lot of microbes and they are healthy microbes. So if they are out of balance, they will allow the pathogenic ones to grow. And once the pathogens, they start growing, be it fungus, parasites, and other bacterial infections, they will take over your digestive system. So a lot of your cravings like food, you're craving for carbs, you're craving for sugar. All this is because of that fungus growing in your body. The parasites, there are various viral infections which are at the root of various hormonal issues and autoimmune conditions. If your diet is rich in refined carbs, refined food, you're basically damaging the lining of the gut, allowing the allowing the toxins to leak back into your bloodstream, and that's what basically is a leaky gut. Your gut has become leaky. So now it's along with the nutrition, it's allowing the unwanted things also to go back into the bloodstream. So what happens in the gut does not remain in the gut. It's traveling your entire body and is one of the most common causes of autoimmune conditions, one of the most common reasons for autism in children, and various other, be it hormonal imbalances also. You're low on stomach acid, you feel bloated after every meal. You've just eaten small amount of food, but you feel bloated. And that's because you are not producing enough stomach acid to digest that food. And this will again continue with the nutritional imbalances. You are not having enough digestive enzymes in your digestive system to digest the food that you're taking. You're chronically constipated. So you're eating and then you're also not removing the toxins from your body. So if these things are messed up in your body, your hormonal health will suffer. And of course, the liver function. If your liver is busy with fighting the infections in your body, or you're taking a lot of medications, so the liver has to remove it. Again, it will allow the toxins to build up, allow the hormonal imbalance to continue. If the liver is doing its function, but the gut is not doing its function, it's a mismatch, or the other way around. Both have to be in good function. And most important, the bile flow. So many people get their gallbladder removed, which actually further impairs the hormonal health. And also basically it is impacting your fat metabolism. All our hormones are made up of fat. Every cellular structure is made up of fat. It's made up of lipids and protein. So imagine if your bile flow is not there, you don't have a gallbladder, you're not able to digest the fats, and your hormonal health, your cellular structure cannot be healthy in that case. The very less spoken function, the mitochondria function. How many of you know what's a mitochondria? Any idea what's mitochondria? So as a kid, we remember, you may remember a kidney-shaped structure in every cell. That's the mitochondria. And yes, it's a powerhouse of the cell. It's a powerhouse of energy. So whatever we eat, whatever we drink, whatever we breathe in, or whatever toxins we are taking, whatever infections are there, all this is affecting our mitochondrial health. You can imagine it's like the engine of a car. Mitochondria is the engine of a car. So if the engine is not working, no matter what kind of fuel you're giving to your body, it will not be able to run. So everything that happens in our body boils down to the mitochondrial function. Your insulin resistance is result of poor mitochondrial function. Your fertility is a result of mitochondrial health. You're feeling fatigued all the time. That's because of poor mitochondrial function. And what causes poor mitochondrial function? Infections. You have chronic infections and you're not treating them. Your body is loaded with toxins. All the toxins will damage the mitochondria. You're exposed to too much of screens. You're working on laptop for 12 hours without any blue light protector. You are right before sleep, you are exposing yourselves to the laptop, to your mobile phones. That is exposure to blue light. That is causing blue light toxicity. Your quality of water is not good. It's dead water. That is impacting your mitochondrial function because it does not hydrate the cell. And if the cell is not hydrated, the mitochondrial function will be poor. And you're deficient in most important nutrients like B complex, carnitine, CoQ10, lipoic acid. If you're low on all these, it's impacting your mitochondrial function. So if this is what your situation is, like this woman in this picture, it's nighttime and you are exposing yourself to too much of mobile phones, you're having blue light toxicity. We are designed to be in sunlight during the day, in natural light, and we are designed to be in darkness at night. But if we are not following this, and we are largely under artificial light during the day, and at night, it's a lot more of artificial light, we are damaging our mitochondria. So I've spoken about a lot of nutrition, a lot of exposure that we're given to our body, but a very, very important role that has on our body is the impact of the stress. What our thoughts are, what our emotions are. And a lot of chronic diseases are manifestations of all these things. And I'll hand it over to Siddarth to talk more about how our thoughts and emotions are impacting our health.
Thank you, Dr. Ruhi. That was a wonderful explanation of pretty complex concepts in a very concise manner. So thank you for setting the stage wonderfully. Let me ask this question to all the participants here. How many of you would say you are stressed out? You can reply in the chat. Okay. Anu, Sarita, Jaguti, Simi, Kiran, Nutan, Neha, Pooja, Kalpana. Okay. And a few of you also raise your hand, the electronic hand. In America, there is a government agency. Okay. This is called the CDC, Center for Disease Control. So Center for Disease Control, CDC, a few years back, it published a report where it said that 80% of all patients who visit their primary care physician, like in America, there is a system, right? You just can't go and meet any doctor. You have a primary care physician. You can think of it as a general physician in India. You have to go to them, whatever your health issue, doesn't matter. First, you have to go to them. Then if they can't solve the problem and you need a specialist, they will refer you to the specialist, right? So CDC says that 80% of all visits to a PCP, primary care physician, are because of stress. Whatever your disease might be, you might have a heart problem, you might have diabetes, you might have BP, you might have migraine, you might have obesity. It doesn't matter what is your problem. You might have PCOD. Okay. Fundamentally, it is caused by stress. This is what, America is saying. And for good or bad, whatever America says or does is what we follow, right? The rest of the world. So it's a good thing that they are beginning to realize this. Whether they are doing enough about it, that's a question mark, but at least that realization has come, right? So let's look at a little bit of what happens when you have stress in your body, okay? What will happen first thing in terms of hormones, because we're talking about hormones primarily in this webinar. The stress hormones will go up, right, in your body. The primary stress hormone is cortisol. Cortisol will go up the moment you have stress in your mind. And the moment cortisol goes up, what will it do? It will increase the sugar level in your blood. Okay. If you are always stressed out, maybe a low grade of stress, always your blood sugar is elevated. What is the impact of that? Body has to increase the secretion of insulin to handle that extra sugar, right? And what were the two fundamental root causes of hormonal imbalances for women that Dr. Ruhi just explained to you 20 minutes back? One of them is insulin resistance, right? So you see now immediately, the moment you have stress, you are actually creating these diseases, these ailments. What else happens? Cortisol makes your cells more resistant to insulin. So not only is it making the body secrete more insulin, it is also reducing the effectiveness of insulin. It is not able to do its work, leading to insulin resistance, leading to all the downstream problems, estrogen dominance, etc. What do you do when you are stressed out? Do you eat very healthy food? Do you go and see, okay, where is a nice salad that I can eat, or which is the fruit that's lying in my fridge or in my kitchen that I can eat? Do you do that, or do you look for all the junk food at that time? Tell me, good food, junk food, what do you opt for when you're really stressed out? Junk with lot of K's, right? Why is it happening? Hogging center, right and left. Exactly. Sweets, junk, sweets. Exactly, right? There's something happening in your body that you are, going only for those things. Stress will create a craving. I don't want to go into the science of it. Okay, it becomes too heavy for many people. But it will create a craving for everything that is unhealthy. It won't make you do anything that is healthy, good for you. Okay. You will want to eat sugar loaded things. You will want to eat carbs, refined carbs, right? You will want to, have cups of coffee or tea. You might want to smoke if you are a smoker, or, have more alcohol, even do drugs. All of these are essentially caused by stress. Actually, saying that is not correct, that they're caused by stress. They're caused by our inability to handle stressful situations. We have not learned how to do that. That is a fundamental. Okay. Now, very, very importantly, I want you to understand this concept very, very clearly and deeply. The moment you create the smallest amount of stress, your body's interest, your body loses interest in any kind of healing, any kind of reproduction, okay, good metabolism and other healthy functions. Your body is no longer interested. Why? We will see that in the next slide. Because We have evolved in nature for millions of years. We lived in the jungle, right? Only for a short period of time we became civilized. We started using technologies where we don't have to fear for our lives anymore, right? On a day-to-day, moment-to-moment basis. As long as we were living in the jungle, we were also food for somebody else, right? Some animal looked at us and said, oh, wonderful meal, yummy meal going there, right? So if you have to survive in that place in the jungle, you have to have a inbuilt hardwired system in your nervous system which will trigger your body's ability to either fight hard and win the battle with this animal who wants to eat you, or you must be able to run or climb a tree very quickly and escape, right? If you're to survive. So the moment you create stress, the only thing that the body thinks at a very deep level is that there is some animal that's trying to kill you and eat you. In other words, this is a threat for your life. Your life is in danger. Tell me something, when there's a tiger chasing you, does it make sense for the body to focus on digestion, to focus its energy there, or on reproduction, or on even healing, imbalances or this or that? Should the body focus on that, all of these things, or should the body pour all its energy into your arms and legs, into your heart, so that it can pump harder, into your breathing mechanism? Which one should it do? The first one, healing the body, maintaining good health, digestion, or the second one? Please answer in the chat. What do you think, first or second? Which makes sense for you? First or second? To save from tiger, which is second option, right? Anyone else? Exactly, right? Second option. Body is just not interested in anything to do with health and all. Because if it is not going to survive the next 5 minutes or 2 minutes, what is the point of wasting its energy in all those things? Right now, the only priority is to survive the tiger, right? Now, today, whether your boss shouts at you or your mother-in-law says something nasty to you, okay, there is no threat to your life. But unfortunately, your nervous system, the limbic part of your nervous system, still behaves like that. It still does all of those changes in the body, including your hormones. Okay. So your body is not able to distinguish between modern days, today's stress factors. It still thinks it's living in the jungle. That is the problem. So if you are creating the stress, then where is the question of good health in the long run? You will create disease. There is no other option. Another thing I didn't mention in that slide about the stress is, the previous slide is, the moment cortisol goes up, immediately your thyroid function goes down. And how many of you are here with thyroid issue? Almost 50% of you in the poll. Okay. So now you see the connection. So what is happening? I'm sorry. So again, on your screen are the variety of symptoms that characterize PCOS, right? Hair loss, anxiety and depression, acne, breakouts, fat in the abdomen region, pain in the pelvic area, cysts, irregular menstrual cycle or missing cycles, or excessive bleeding, heavy bleeding, etc. Right? Pains and cramps during the periods, weight gain overall, and difficulty in losing it, no matter what you do, whether you do dieting or exercise or this or that, it barely comes down and then again shoots up. Growth of hair on the face and other parts of the body, or even dark spots, skin tags. Sometimes in the neck and all, there will be patches of dark skin where the skin folds in those areas. It's known as acanthosis nigricans. Insomnia, racing mind, right? All of these things. I think somebody mentioned in the chat also, overthinking. Tell me something, all of these things, what is the treatment you are being given or that you are taking? One pill in the morning, right? The hormonal replacement pill, etc. Do you think such a complex problem, right? We have spent the last half an hour explaining the different root causes, the different reasons that lead to the development of these symptoms. When the reasons are so complex, do you think one pill alone can fix PCOS? How many of you think like that? Anybody? Or how many of you think that no, it cannot? It cannot. Yes, it's obvious, isn't it? Anybody who takes 5 minutes to understand why these problems are happening, right? They will come to the conclusion that just taking some pill cannot fix it. It can, at best, it can be a band-aid solution, right? And obviously, the more you do that, the more your problem increases because you're suppressing the symptom. Same thing, right? As I said, most of you, I think the largest percentage, in terms of the health issue is thyroid. So let's look at some of the common root causes of thyroid issue. Okay. Factors that can contribute to proper production is good availability of nutrients. What are the nutrients? Iodine is something that all of us know about, right? Iodized salt and all that. We don't know about iron. We don't know about an amino acid called tyrosine. We don't know that zinc plays a role. Selenium is vital. Vitamin E, B2, B3, B6, okay? Vitamin C, vitamin D, etc. Those of you who have thyroid problems, have you taken a look at all of these factors, all of these nutrients? Are they optimal? And remember, I'm using the word optimal. Just being above the lower end of the reference range doesn't cut. Okay, you have to be at least above the midpoint of the reference range. Otherwise, your body doesn't have enough. Now, you need to remember that the primary production of the thyroid gland is T4. This is inactive. This has to be converted into T3 for it to become active in the body. However, there is another form of T3 called reverse T3. Reverse T3 is basically the inactive form of T3. Now, there are many situations in the body which can increase the conversion of T4 into reverse T3 and thereby reducing the amount of T3 available to you, right? The first reason is stress. The moment you create more stress, reverse T3 production will increase. Trauma, low calorie diet, people go on severe dieting to lose weight and all. It's a disaster in many, many ways for the body. Inflammation, chronic inflammation, toxins, infections, liver or kidney dysfunction, because the majority of this conversion of T4 into T3 or reverse T3 happens in your liver and kidney. And there are also certain medications which can actually increase this. Okay. Now let us look at, on the other hand, factors that inhibit the proper production of the hormones, the T4 itself. Once again, at the top is stress, then infection, trauma. Certain radiations can do that, including your blue light radiation that Dr. Ruhi was explaining to you. Certain medicines can do that. We all very happily do use fluoridated toothpaste. Fluorine is a toxin to your thyroid gland. Okay, it replaces the iodine which is required, and then your gland cannot produce the T4 hormone. Many toxins, heavy metals, mercury, lead, etc., and many other things can do this. Also autoimmunity, right? Hashimoto's, etc. And there are factors that increase the conversion of T4 to T3, and this is something that we want. And two fundamental nutrients for this process are selenium and zinc. How many of you who have thyroid issue, hypothyroidism, have bothered to, ensure that you're taking enough of these two amongst the other things? Very few, right? Also, it's not just important that your body is producing enough hormones. Like how, we explained the concept of insulin sensitivity. Similarly, your cells have to be sensitive to thyroid gland, the thyroid hormones. And there are factors which can increase or decrease that sensitivity, right? Vitamin A, moderate amount of exercise, and zinc are three important factors which improve the sensitivity of your cells to thyroid hormone. Now that you understand the complexity of the thyroid process, and believe me, this is just the the surface of the whole process that's happening in your body. But now that you at least understand this much, once again I want to ask you this question: can a pill alone in the morning fix all of these issues? Yes or no, please? You can answer in the chat, please. It cannot, right? Now tell me, how many of you been doing this, taking that pill for months and years in the morning and hoping it will work magic and solve your problem? How many of you been doing that? Everybody who has a thyroid problem, that's what they're doing, right? So you see, we are just not going in the right direction. How will the problems get solved? Some of you are constantly, annotating, you're putting lines and dots on the screen. Please don't do that. It's distracting for everyone. And Harsha is saying very, very correctly that actually it has caused more issues. Yes, it is possible. It can cause more issues. Autoimmunity, right? Another major problem. So autoimmune conditions can affect any system in the body. This is something we need to understand. There is a process which is leading to autoimmunity. This is different from your autoimmune disease, whatever your diagnosis is. Somebody can be SLE, lupus, Hashimoto's, rheumatoid arthritis, XYZ. These are all, these are all just examples of different organs being affected by the autoimmune process or autoimmune condition. They are not necessarily completely different diseases. Okay, the root cause is same. The root cause is in your digestive system, by the way. So whether it's psoriasis, eczema, rheumatoid arthritis, lupus, Hashimoto's, Graves' disease, fibromyalgia, osteoarthritis, the list goes on. Over 50 commonly recognized and diagnosed autoimmune disorders are there. They are just an expression of which organ is getting affected, not the problem itself. And there are many factors. Stress again plays a very major role. Viruses, bacteria, parasites, fungus in the body, certain types of medications, hormonal, taking hormones from outside, certain toxins, heavy metals, all of these can trigger the autoimmune process. Yes, there is a small role of genetics which makes somebody more susceptible, but that is not creating the disease, it's only creating susceptibility. Disease is being created by our choices, right? Things that we do or we don't do in our lives. So all autoimmune conditions are essentially the same process. Out of control inflamed immune system and a trigger which is directing the immune system to attack certain part of the body. Once again, the same question: can a lifelong anti-inflammatory medication and immunosuppressive medication fix autoimmunity? Does it make sense to you? Yes or no, please? It's obvious, right? It's so obvious. Anybody can see it now. So the question is, are you willing to do what it takes, isn't it? So what it takes in our understanding is the functional medicine approach, which is an integrative system, right? The fundamental is that we are looking at the body as a whole. We understand that different parts of the body interact with each other. Different functions in the body impact each other, right? So identifying and addressing the underlying root causes of dysfunction in the body is the idea. Because only when you identify this can you actually address the root cause. Otherwise, how will you solve the problem? You'll just keep popping pills, right? And once you address the root cause, the problem will start reversing, as some of you saw in the testimonials videos that we played in the beginning, right? Issues that they had been struggling with for years and years, and every year it was becoming worse than the previous year. In a period of 3 months, they're just starting to vanish. Somebody who's told that the only option for you is knee joint replacement, in 2 months knee pain is gone. Somebody is told that the only option for you is to remove the uterus. 3 months later, there is no pain left. The bleeding, the flow has also come down to 5-6 days, which is normal. What is happening? Because you identified and addressed the root cause, the body started healing itself. So we treat the whole body, not just the symptoms. So we look into the unique root causes of your health issues and help you regain your health and be happy and vibrant again, right? What are examples of these root causes? We already discussed these, right? Most of these: toxins, heavy metals, chronic infections, nutritional deficiencies, inflammation, poor digestive function, mitochondrial dysfunction, poor detoxification, and very poor ability to handle stressful situations. Okay, non-native EMF, which is radiation from all of this Wi-Fi, etc., and poor water, poor hydration, a very, very important consideration again, right? And these are all, I'm showing that with different dots or different arrows, but actually all of them are connected with everything else, all others. So toxins will create inflammation, they will create nutritional deficiencies because your body will not be able to absorb nutrition. They will impair gut function, they will create mitochondrial dysfunction. They themselves will bring down the detoxification capability of the body. Okay, just one example I'm giving you. Toxins will do all of this and more, right? So all it's like a very dense interconnected web there. It's not just straight lines like this. It's a pretty complex situation. So now once you start identifying and then you start addressing the root causes, what are the signs that you are beginning to heal? You will see within a few days your energy levels will start improving. Things like headache, etc., will start going away. Your sleep quality will improve. If you have issue with your periods not being regular, etc., that will start regularizing itself. Your skin will start glowing. You will feel more in tune with yourself, with your body. And many people say, oh, there is no way, you don't ask me to give up sugar, I cannot do that. Okay, it is not you. Okay, there are imbalances, there are bacteria, there are fungus which are making you crave sugar. As you address all of those, your cravings will go. Okay, your bloating, your constipation will come down. Overall, you will be less puffy and inflamed. So you will be better in every single way that matters to you. And very often what has happened is that participants have shared that I came for these 3 problems, but these anyways got resolved, but there are other 4-5 things that I thought were small, not really worth bothering about, they also got resolved. Why? Because we did not focus on your symptoms. These issues are symptoms as far as we are concerned. We address the whole body, the entire body, the interconnected root causes. Once they get resolved, everything will improve. So we offer a 12 weeks group program called the Hormone Reset Program, right? What I want you to understand is the thought process behind the program, how it is structured, right? We are not interested in just managing your disease. We want you to learn how to reverse it, get rid of it. So we start with a very detailed process of history taking. We want to capture as much details about your health condition, about the history, etc. Based on this data, we ask you to do certain amount of testing. Now the testing here is much deeper than what you generally do. Why? Because normally the testing is only intended to find out what is going wrong in the body. We want to know that, but more importantly, we want to know why it is going wrong. Correct? That's the whole idea of understanding the root causes. So we'll ask you to do certain testing. Based on all of this information, we will analyze and come up with what are the root causes for your issues. And we'll create a detailed personalized plan, which will include everything: nutrition, diet, lifestyle recommendations, supplementation plan, gut and liver support, detoxification, everything. We also will, help you learn and start practicing simple stress management techniques, calming techniques, breathing techniques, emotional, how to handle, troublesome emotions, how to get rid of them if required. We also will take you through a 3-day guided detox process, a very simple but a very, very effective and powerful process to remove toxins from your system. And as some of you heard in the testimonial videos also, many of them were actually talking about this 3 days of detox process. It's like it stays in their minds that this made a huge difference. Shopping list, handouts, access to nourishing recipes, everything that you need, the entire support structure is there for you to bring about the required changes in your lifestyle. Live sessions over weekends to empower you, okay, with a lot of detailed knowledge, with a lot of motivation and a lot of support to execute whatever you need to change. Real-time support and hand-holding is available from the team. Any questions, any doubts you have, you can reach out on WhatsApp group, or a direct one-to-one message, or even a call can be set up. Obviously, again, one more thing I want to highlight here is that this program is a combination of two things. See, the treatment process has to be personalized. That cannot happen in a group, right? Because treatment can only happen of one person at a time. However, your lifestyle changes, learning how to, let's say, make healthier food, that can happen in a group, right? And it actually is much more effective and much more interesting when you do it together instead of doing it alone in an isolation. So the program is a beautiful mix of personalized treatment process and a group program. The group program makes it a community kind of a thing. So the group sessions for the next batch will be starting from the 29th of October, which is a Saturday. This is the week after Diwali, right? So all festivities will be done, and it will be a wonderful time for all of us to kind of shed all the extra kilos that we have gained in the last couple of months, right? Eating all kinds of sweets and savories and our favorite stuff, and maybe also aggravated some of our health conditions. So it'd be a wonderful time to get tighten our belts and get down to business. The group sessions start from 29th of October, but if you register, let's say tomorrow, the personalized treatment process for you starts from tomorrow. So the program, as I said, has two components. The personalized process starts from the day you register, and the group sessions will start from the 29th of October. The program cost is very, very, for what we offer, it's a very, very cost-effective program, only 12,000 rupees. And for all of you who have joined the webinar today, for the next 3 days, we are offering it to you for 11,000 rupees till 20th of October only. So with that, we will open up for questions. If you have questions, you can unmute yourself now and ask. I will stop the screen sharing here.
Hello.
Yes, please.
Yeah, I have a chronic lichen planus condition, and I have gained a lot of weight post delivery, and I'm 38 years old. Now, is this something that I should be following, or? And I do have very heavy periods, which are painful periods.
Okay. Your name Nishchita, right?
Yes, ma'am.
Okay. So Nishchita, lichen planus, it's a fungal infection, right?
Okay.
Of course, it's an autoimmune condition, but fungal infection has a major role to play there. Okay. And again, which again is also impacting your hormones. So if we address the fungal infection, we address the underlying, imbalances in your body, we will be able to bring down the inflammation in your body and help you see yourself healing, right? The patches will start resolving, your period issues will start resolving. The inflammation in the body will start coming down.
Yeah, so I'm hoping that this program will do what
It
I've
will,
been looking for.
absolutely.
Absolutely, yes. Absolutely, yes.
So before we go to more questions, we just want to, we'll take all the questions. We want to launch another poll for all of you to answer. Siddarth, can you do that?
No, I am not able to do it.
Okay, all right. So we're just launching another poll. I request all of you to answer that, and then we will start taking up all the questions. So I request all of you who are here right now to answer the poll. And yes, so while the others answer, the next one can ask their question.
Yeah, hi, this is Supriya. I've named myself as SP.
Okay, yes, Supriya.
Yeah, so I took this session sometime back also, but then due to some reasons I could not enroll. So basically, my question is that I actually do have IBS-D and hypothyroidism since quite some time, but all those typical things of gaining weight, etc. It's not like that. Like I've always had a build which is a slim build. So by the looks of it, I am none of it. However, the IBSD has taken such a toll that I'm like having this chronic UTI also. And my query to you is that of late, over time, I've also become like lactose intolerant and all those things. So in the functional medicine approach, do you I mean, whenever you see individually, will you stop completely all the foods, or there's a way to get the particular food back, or like there will be a lot of restrictions of food? Like that's my basic query.
Okay, see, to start with, of course, we will have to identify all the possible triggers, right, which is making your immune system hyperreactive. Okay, so that will include excluding every possible thing that that can be adding fuel to the fire. Okay, which includes gluten and lactose. Let's also understand any sensitivity that we have is resulting from a lack of diverse microbiome. Okay, if we do not have the right bacteria to to break down lactose, to break down gluten, and a lot of other things, right, that one may be sensitive to, we will be facing trouble every time we take that food. Okay, so to start with, excluding is very important, and then as we do that, we also work on improving the gut microbiome. Okay, so over a period of time, as your body heals, right, you will be better able to tolerate certain foods which you're not able to do right now. Okay, again, that does not mean that you start indulging yourself in in milk and gluten, right? Because of course, over a period of time, you will not be responding so badly to those food, but again, it cannot be like going back to binging on those food. But
So
the situation will not be the same how it would be today.
yeah, no, I get it. But as per so I'm a doctor myself, okay. But as per what you've just said, like personally, I'm not consuming a lot of milk. However, if you eliminate something completely and when you get back to it, won't it be a little difficult? Because chapatis and all roti is a very basic diet. You must be, that's my query. You must be getting gluten tested, or you will be eliminating it completely.
I don't have to test gluten, and always a gluten. Most of the time when our clients test for, gluten antibodies, it's not necessary that those tests are accurate. Okay. let's also understand we've been growing up with, having known wheat chapati as a basic staple food, right? I'm from North India, and
Yes.
chapati, gehu chapati is the standard staple diet there. But that's from our ignorance of not being exposed to a diversity of grains which our country has to offer. Okay. So there is a whole lot of other grains that, which are much more healthier than what wheat we are, kind of so addictive to. And again, wheat, the gluten is addictive. And that's why it's difficult to give up gluten. But then the moment you start adding other grains, your diversity of microbiome improves and your craving for, those limited food starts decreasing.
So
Okay.
that is one aspect. The other thing is once the healing has happened, definitely you will be able to, once in a while, if you eat gluten, you won't have much of a problem. But will you be able to eat it every day? May not be.
And trust me, you may not even want to go back to that food.
You will
because
not.
you
Oh, we
start
have all,
feeling-
yeah.
Yeah.
So, when I left gluten, I was like, oh my God, how will I eat? What will I eat, etc. The same thought process that you're going through right now.
Yes.
But anyways, you kind of, plunge in and you make the change. And one
Because
or
I
two.
think why I asked this very, very particularly, because last time I had a word with someone, I don't remember exactly. So they told me you have to go off gluten, and I was like, you cannot
No.
avoid it.
So allow me to complete.
Yeah.
So that's what I
Yeah.
exactly answered, that once you have allowed the healing to happen,
Mhm.
then once in a while, if you have it, it's not going to, wreak havoc. The other thing is, once you have given it up and you have moved to other grains, you will realize after 1 or 2 months of being off gluten, once you eat it, you will realize actually it tastes much more bland compared to the others. Then because now your taste buds have, expanded, you will realize, oh, it's actually quite tasteless. It's quite bland. And that craving will not be there. You can have it once in a while if you need to sometime. Okay. But you will not want to have it every day. Guaranteed.
Actually, I was not coming to the want. It is just wherever you go, if you go out or in the house, it's like the staple diet everywhere. Okay, anyway, if it's possible for someone that if we can connect, and that's what I put in the poll, if someone can connect, probably like
Sure.
I'm interested to join, so that would be helpful.
Sure.
Okay, thank you.
Welcome.
Shikha, you have a question? Shelly, if you are there.
Hi. I had a bunch of things to ask. Am I audible?
Yes,
Yes.
Shelly, you are.
Yeah.
I think we had a call a few days back,
Yes,
right?
hi. Yes, we did talk. I actually don't quite remember if I told you everything, but I have fibroadenoma. I think I told you, did I, Siddarth?
Yes. Yes.
Yeah. So like I do feel like pain in the breast and all that. And I wanted to know whether, because every time people address PCOD, thyroid, and all of that, I don't really know if I have thyroid. My regular tests are fine, but then I know that functional tests go a little beyond the normal. But I wanted to know that will this help me in my hormonal issue, which is basically the breast health?
Absolutely. That's the whole crux of the entire effort that we're making, Shelly.
Yeah.
Correct. And I guess if you were there throughout the webinar, I think you already have the answer with you.
Yeah, I know. I was there from the beginning. And yeah, I think that's pretty much what I wanted to ask. Because right now, this is predominantly the issue that I'm facing, along with some discharges here and there. I mean, sometimes it's in control because I'm on Ayurvedic and homeopathy, but I want to have a clear cure, because living in fear doesn't help.
Absolutely not.
It just
You
makes
should
life
not live
more
in fear.
difficult. Yeah. So that's there. And yeah, so is this, how different is this from the individual plan? I see that a lot of people are asking this question. So
see, the treatment process for both is the same. Okay. The group program has the additional aspects where you have access to much more learning, understanding the whole problem, the interconnections much more deeply. how different things are impacting your health, etc., and what you can do to change it. And you have a community with which to work together in that direction. So there's a lot of support, there's a lot of motivation, which is not there in the individual program.
So is our food going to be same, the one that's going to be given to all of us?
Some fundamentals will be same, and for individual people, there will be some changes that will be there.
Okay.
Yeah.
Also, like, does it also address inflammation?
Without that, you can't solve any of these problems,
like
actually.
a lot of my hands and my legs, they pain a lot from I don't know if it's muscular or it's bone, but because I don't know, I don't know what to
Understand
feel.
it this way. We will not be addressing one health problem of yours or two health problems. It will be from head to toe. We will be understanding what's going on in your body with the help of the detailed history taking that we will do, which will ask you a lot of questions, and it will make you think over that, okay, do I have trouble this? Do I have, any problem here? And we would be correlating that with your, with your investigations, and then looking at what's going on. So whether it's inflammation, whether it's your, your breast pain or the other issues, all those things will be considered when we are working, on your treatment plan.
Okay, thank you.
Okay. All right. Preeti, are you there? Preeti
Yeah.
Pujari?
Hi. Yeah. Hi. I just want to know, like, I have hypothyroidism, and that too is an autoimmune.
Okay.
And in my case, I don't gain weight, I lose weight.
Okay.
So that is also one of the other problem, and I have severe hair fall. So I just wanted to know whether this all can be taken care, because I have heard many a times people talk only about weight loss, no one talk about weight gain. But my case is completely different. So will
Okay.
this help? Or
See, it's an autoimmune condition, right?
Yeah.
And there's several reasons for autoimmunity, which we would be addressing. And regarding your concern of losing weight, right? Of course, if your gut health is not healthy, whatever you may be eating the best food on the earth, but it's not becoming a part of your body. Okay.
Correct.
So we will look into your gut health, and if the gut health is really messed up, we will work on fixing the gut health. And as we do that, your concern with losing weight will also be addressed.
Okay. And currently I took the pills as well every day for thyroid. So
Yeah.
even that will be reduced, or what impact will this program have?
So we won't reduce it or stop it in the first go, right? We will allow your body to first prepare itself, start responding. And as we do that slowly over a period of time, your need for a certain dose will start reducing. Okay, you will see right now, even with the pills, your hair fall is terrible, right?
Yeah.
But as we start working on giving your body what it needs, you will see your hair fall also getting better.
Okay. Okay. Fine.
Because we will be giving your body the building blocks for your hair. We will be giving it the building blocks for a healthy gut and a lot of other things, right? So as we provide the body the raw materials, its need for an external fix will start reducing.
Okay. Okay. Fine. Yeah. Thanks. Got it.
Okay. Shruti Subramaniam, are you there?
Yes, I am. I think most of them have asked my question, but I just wanted to know. So I get acne whenever I consume dairy or gluten, and I am also guessing I have a lot of bowel issues. So I'm guessing it's all related to the gut and how I need to restrict. So I was just wondering if the 3 months would be rigorous restriction, because sometimes when I travel or something, I can't restrict. Or let's say like screen time, my work requires me to stare at the laptop for 9 hours a day, and I won't be able to restrict that. So would that disrupt the healing process?
See, when it comes to screen time, of course, I mean, the kind of life style we have today, right? We require to work for a certain number of hours during the day. But then there are various hacks that we will, and various strategies that we include during the program, which will help you protect yourself from blue light toxicity. Okay, for a very simple thing, I'm not sitting in a white light right now, right? What I have turned on is a red light. Okay, so I am not getting that blue light toxicity. I am wearing glasses which have a blue light blocker. So this way, there are various strategies that we can implement to protect ourselves from the damage to the damage of the blue light toxicity.
Okay, got it. And also, I might not be able to sign up for the October one because I will be traveling a lot in November and I won't be able to follow it well. So, would it be released again, or is there any individual program that I can maybe sign up later?
So, our program starts every month. If you are not able to join in this batch, you can join for the next one.
Awesome. Thank you so much.
Okay. Anu, you have a question?
Yes, sir. Hello. My daughter is 9 years. She's having alopecia. She's losing her hair in patches. I think it's a genetic, and family members also we have. So can it be cured? She's having skin issues also, eczema and Hashimoto. We have done blood work also.
Okay, all right. So Anu, so she has Hashimoto, she has alopecia, she has eczema, right? So I can already see that the autoimmunity is affecting her hair follicles, it's affecting her skin, it's affecting her thyroid gland, and she's just 9 years old. Okay. Now, whether it's genetic or not, let's understand. See, we may be born with certain genes. Okay. If we are born with good genes and we don't give it the good environment, the good genes will not manifest. Okay. On the other hand, if you're born with bad genes and we give it a good environment, the bad genes will not manifest. Okay. So the genetic component only can make anyone susceptible to it, but it does not decide the fate of that person. Okay. Now, with your child, the autoimmunity is impacting different organs in her body. But if we correct the root causes of the autoimmunity, we can stop the process. If we don't do that, the autoimmunity will start impacting more organs in her body. Okay. And it will take a toll on her health as she grows. Okay. So it's very important that we correct it now, fix what is causing alopecia. I mean, all these autoimmune conditions, right? The root causes boil down to poor gut health, fungal infections, parasites are at a major play, nutritional insufficiency, poor mitochondrial function. So we need to identify what's causing the trouble in her, fix them, and she will be able to correct her autoimmunity.
Yeah, what we have to do now next?
So you can leave your number, Anu. Our team will connect.
Okay. Okay.
All right. Ramya, you have a question?
Yeah, hi, I'm Ramya. Actually, I have a small problem. I had a rheumatic fever during my childhood, and I had taken all those, injections and those things. But after a period of time, all it got cured. At present, whenever I am eating pomegranate, fig, or tribala powder for a couple of days together, I'm getting patches, say bruise mark on my thigh or legs. So if I stop the particular thing, whatever I am consuming, after 4 or 5 days, it goes away, it's so. And my blood reports all are normal. So this is my question, whether I would able to tell me, sorry.
Yeah, I think I answered you on the private chat when you had texted. See, if your body is reacting to these 3-4 food, right? So there is definitely a reason that your why it's behaving in that way. So possibly it's not able to process these certain ingredients. Your body is not responding well to it. Okay. Trifla is a combination.
Okay, but actually till last year, I have been consuming all these things, but suddenly will it happens? That is what
can happen. It can happen.
Okay.
Yes, yeah. See, last year and this year, there's already a gap of 1 year, right?
Yeah.
There's so many situations. It can be an infection that can just change your body's response to various conditions. It can be
a very stressful period last year to this year.
Absolutely.
It underwent to a lot of stress in my family life and for my parents, and health issues. Everything affected my mental health also.
There you are, right? Stress issue has already come up. So it can impact in various ways, and
If
Siddarth
I am
spoke
taking a course
about
with
it.
you, will you able to help me? Because, yeah.
So, Ramya, definitely we will be able to help you. But of course, I won't say that, yes, after 3 months, you will be able to eat pomegranate and these 3-4 things without any issue. Because again, there will be a lot more things, that will be underplay here. But definitely, you will see things getting better for you.
Okay. Okay. Thank you.
Okay. So, I think we don't have any more questions. If you haven't responded to the poll, I request you to do that before we log off. And any more questions, anyone?
Hi.
Yes, Shweta.
Hi. So I had basically two questions. One was just wanted to understand the structure of the program, as in, would it include daily sessions, or when you say group sessions, how often they would be, and when it comes to personal sessions, how often they would be? And if the program is for 3 months, so what kind of interaction would be happening? Would it be like on a daily basis, or how it would be?
Okay.
And the second thing was, does this program basically include lifestyle and dietary changes only, or does it also, do you also prescribe certain medication?
All right. So first, with respect to the structure of the program, the sessions are on the weekend. Okay. So
Okay.
we have sessions on Saturday. And
Okay.
in the first month, there will be 5 sessions. So all 4 Saturdays will have a session. And on the first Sunday, we will have a session. And this, on Saturdays, it's in the evening at 5:30.
Okay.
In the second and third month, we will have 2 each.
Okay.
Okay. So in the first month, we are meeting every weekend. In the second and
Okay.
third month, we are meeting every 2 weeks. And in the
Okay.
second month, we will have additional session for the juice fasting program, which is a 3-day juice fasting happening over the weekend.
Okay.
In respect to how often we are interacting, so we are interacting during the sessions. The personal sessions are 2 in the program, once in the beginning after your treatment plan is sent, and second in the 3rd month. So anytime in the 3rd month, we plan it.
Okay.
And, of course, we have the WhatsApp group for communication where participants share what they are doing, their challenges, and that's where we all stay connected.
Okay. So basically, you're saying that it's basically a weekend thing. So
Yes.
if you're busy on the weekdays, that's not a concern.
Yeah, absolutely. Yeah, we understand, right? We don't want
Okay.
to interfere with the day-to-day thing. So we are
Okay.
connecting over the weekend.
And you said personal, there are 2 personal sessions.
That's right.
Overall.
Yeah.
Okay. And in between, in case there are certain questions, or if we have some
Over WhatsApp.
queries.
You
Okay.
have complete support over WhatsApp.
Okay.
And the group sessions that are happening, you can also ask your questions in those group sessions.
All right. Okay.
Every session has a Q&A time allocation.
Right. Okay. And about the second query was about the medication and what kind of.
So we don't use drugs. There are no drugs that we use. Largely, it's a lot of lifestyle-based strategies, a lot of nutrition, and a lot to do with supporting your detoxification pathway, supporting your gut microbiome, supporting nutritional insufficiencies, where we will use certain nutraceuticals.
Okay. All right. Understood.
Yeah. So we'll take one last question from Harsha. Harsha, you are there?
Yeah, hi.
Yes.
I just wanted to know, will your program include having organic food and things like that? Because availability of organic food is kind of difficult. You don't know whether it is actually organic or not.
See, of course, we can't ask everyone to have organic food. Of
Yeah.
course, it's best if one can have it, but availability, cost, and there are a lot of other factors involved when it comes
Exactly.
to organic food, right? So
Okay.
it's not a mandate, right? We
Okay.
would definitely ask you to eat as healthy as possible.
Okay. Also, does it include intermittent fasting and the 5 minute that I've been hearing about on YouTube, that it helps in curing your autoimmune? The 5 minutes by Dr. someone from the
Agarwala.
south. Is South. Yeah, exactly.
Yes.
So,
Definitely 5 millets are a great addition to the diet, right?
okay.
Because
Okay.
it gives you different varieties of nutrients and minerals, helps you in
Hmm.
inculcating a diverse microbiome. So yes,
Okay.
we do advise on that.
Okay, fine. And one last question. My daughter, she is 13 years old. Okay. However, she is having a lot of heavy periods and cramps, and she's not able to put on any weight. Okay. Though she keeps on eating the entire day, but she's not able to put on weight. And also, she has been diagnosed with first level of diabetes, and she is on homeopathic medicine right now. Even I am on homeopathic medicine for hypothyroid. But my doctor is saying that if it is autoimmune, it is not going to be reversed. If it was not autoimmune, it could have been reversed. So just one doubt, like, is it
Okay.
possible to reverse this?
Okay. So now if she has diabetes, that means she definitely has insulin resistance. And in the beginning, I spoke about how insulin resistance is contributing to hormonal imbalance. And that's the case with your daughter. Okay.
But
If
so
it was,
early, like at the age of 13.
yes, yes, yeah. See, today, I mean, it doesn't matter, what you are eating, you're feeding your child as well, right?
Yes.
So, I mean, the same food, if it's, let's say, if it's rich in refined carbs, if it's, if she eats meat, if she eats dairy, right? So that is messing up her hormones as well. And
She
second,
is not actually eating dairy. Even I don't drink milk. I do to some extent have yogurt, uh, but milk I have actually stopped drinking. Even she is from childhood, she doesn't like to drink milk. Second thing, I have done my food science, so I know a little bit of things that was going on in the seminar. However, the thing is that in my studies, what we were taught as a nutritionist is that food that we eat has to be wholesome, like the dal, chawal, roti, sabzi. Everything together helps to lower down the glycemic index of your carbs. Okay? So there is this confusion over here that some say you have to remove rice and wheat out of your meal and opt for something which is more healthier. But practically, it is not possible to tell you that, to absolutely remove rice and chapati from your meal. So for the 3 months, I think we will be able to remove them. But after that, if we introduce these foods, so will the disease jump back, or what it is?
so Harsha, if first of all, when you are saying, right, that removing rice and wheat is not possible, but if you know that's contributing to your ill health, it is very much necessary. And there are a whole lot of other options. See, white rice is not the only grain available on earth. Wheat is not the only available grain. If one has autoimmune condition, high inflammation, you cannot keep feeding your body white rice. You cannot keep, your child is already diabetic. You cannot keep feeding her white rice. It's just carbs, and it will worsen her insulin resistance. Okay. And again, I don't, if your doctor has not checked for, if he's suspecting autoimmunity, the C-peptide should have been checked to see if she needs insulin, right? So that's
Okay.
something that should be done for your child to rule out any autoimmunity there.
No, for her case, it is just borderline, and she has addressed it to some stress level for her, and due to lifestyle problems like a lot of time on screen, and sleeping time is irregular.
So a lot of
things like-
time on the screen is blue light toxicity, and it's impacting
yes, I
her
agree to that.
mitochondrial health. Yes.
I
So,
agree.
and you mentioned she's eating, but she's not putting on weight because her machinery is not working well.
Mhm. So will this program help her as well?
Yes, it will.
Because for her age to remove food like this is very difficult. For us, it's fine because we know.
I don't
that we
agree there,
can-
Harsha. We work with children as little as 2 years old. And
Okay.
we have been very successfully able to offer all the children in our other programs a very healthy lifestyle with the right food, excluding all these, if these have been troubling them.
Okay. One last thing, I won't take much time. Will the program provide exercise routine as well? Like what exercise am I supposed to do? Like if I'm hypothyroid, but I have issues with my flexibility, like I get a lot of body cramps and things like that. So will that be personalized to me, or only the diet will be personalized?
So we do have a session on physical activity, but it's not but we don't offer personalized recommendations on exercise.
Okay.
But we will take you through what's the right kind of exercise one should be doing.
Okay, fine. Okay, thank you so much. I have shared my
right.
number with you. If possible, you can give me a call back and we can discuss this little more. Yeah.
Sure.
Thank you
we
so
will
much.
Connect with you,
Thank
Harsha.
you.
Okay. All right. We'll wrap up this sessions. If any of your questions are unanswered, please, I hope all of you have joined a WhatsApp group, and you can ask us your questions there. You can connect with us, reach out to us, and ask us any questions that still were unanswered now. Thank you all of you for attending, and we look forward to some of you in the program. Thank you.
Thank you, ma'am. Thank you,
Wonderful.
sir.
Thank you. Thank you.